We are so honored to have again with us Dr. Paul Marik, who is paving
Legendary.
the path, yeah, legendary, and paving the path to something that's really near and dear to my heart because I have so many patients calling my practice with new diagnoses of cancers. And he is really kind of who I'm following, and he's been a legend in kind of showing what some of these repurposed drugs can do to help fight cancer. So, Paul, go ahead and give us a little bit information about what you've been doing and what you've been seeing.
Well, thank you, Sarah. Thanks for having me back again. And so, obviously, this is a dynamic process. It evolves every day as we're learning, as the science evolves, and we need to be clear that this is not just coming out of thin air. We follow the science closely, and this is supported by an enormous body of scientific evidence. But what has become clear is our understanding of the process has evolved. So when I started, we had a list of, I don't know, 35 repurposed drugs, but we have now a much better understanding of how they work together, how to group them, which ones to use together, which ones to use for different cancers. And so that gives a much more logical and scientific approach. So to actually tell you what happened is really kind of interesting. So for the last 2 years, I've been reading papers, maybe 2,000 papers on repurposed drugs, and came out with my first book and then the second book, in which I listed 35 drugs. But I had listed them, in an order I thought made sense, but it was very much based on just common sense rather than a way to scientifically validate it. And then my co-conspirator, Justice Hope, said, you know what we should do? Why don't we ask artificial intelligence, AI, what AI thinks and how we should rank these drugs? And so then we started ranking the drugs according to AI. At first, I was a little bit suspicious because I thought AI would be controlled by big pharma and the enemy, but soon to discover that the information it provided was remarkably accurate and
Mhm.
supported by scientific references and made an enormous amount of sense.
Mhm.
So the remarkable thing is, and so maybe this is why we know it's valid, is that AI's list of drugs and our list of drugs were almost the same. So
Wow.
what took me 2 years to do, AI did in 5 minutes. And since we've now understand how AI works better and we know how to ask it better questions, it's become more refined. And so basically, to a large extent, chemotherapy is shotgun therapy. You give an agent which damages chromosomes. It's not specific. While there are targeted therapies, it's not specific, acts on one specific pathway, and it does a lot of damage. And probably the most absurd thing about chemotherapy is it damages the immune system. It
Mhm.
damages your T cells and your lymphocytes and your B cells, which are the cells you most need when you have cancer. So you
Sure.
need to have your immune system fighting the cancer. But what does chemotherapy do? It knocks out those very cells that you need to fight cancer. So it actually makes no sense. It's a completely meaningless, senseless kind of therapy. So the way we've kind of looked at this now is that cancer has a number of components you need to deal with. The first is the metabolic dysfunction. So, what we do know, going back to 1924 and Otto Warburg, is the cancer cell is metabolically different. And all cancer cells are metabolically different. It doesn't matter what an oncologist says, that is just an absolute truth and a fact. So, the first line of therapy is to use drugs that target those metabolic pathways. And so we know which drugs do that, and we know which drugs which pathways they target. You know,
Mm.
pathways such as what's called HIF1 or CMYC or NF-kappa B. These are specific biochemical pathways. These aren't random pathways. Hexokinase 2, these are specific pathways in the cancer cell. So the first line of therapy is to target those biochemical pathways which the cancer cell relies upon, because cancer cells need glucose. They're highly glucose dependent. This is the Warburg effect. They cannot undergo oxidative metabolism. So the metabolism of the cancer cell has changed. So we, as clinicians, can use this to our therapeutic benefit by targeting those pathways which the cancer cell uses. It's pretty simple because they are different from normal cells. The pathways are different, and it just so happens some of the most powerful pathways are affected by EGCG, which is green tea, and curcumin. Isn't that astonishing?
Right.
Beautiful.
The most powerful pathways that interfere with cancer metabolism is these two.
Wow.
So the first approach is to deal with the altered metabolism. And then obviously together with that is diet. I mean, you know, most oncologists are completely clueless, but we know these cells are dependent on glucose. So you need to limit the amount of glucose you take in. Now, obviously, we would suggest a ketogenic diet, but for some patients, it's not that easy to adopt a strict glucogenic diet, ketogenic diet. But you know what? You need to reduce your intake of glucose. Glucose generally is a cellular toxin. It causes glucose and carbohydrate addiction. So patients should just cut out processed food and glucose. Because if they think about what they're doing, they're feeding the cancer cell with the sodas and carbohydrates that they're eating. They're feeding the cancer cell. So if you use metabolic therapies, which we've mentioned, together with dietary manipulation and ketosis, that's really the first pronged approach to dealing with cancer. The second is something called a cancer stem cell. And it seems like oncologists have no idea about a cancer stem cell because they don't deal with it. And so the cancer stem cell is the cell that gives rise to the cancer. And so the astonishing thing is that chemotherapy does not kill the stem cell. In fact, many chemotherapy drugs actually promote the growth of stem cells. So what you're doing is you're taking away the rapidly dividing cells, but the stem cells, which ultimately give rise to the cancer, you're leaving alone. And these then give rise to metastatic spread. It is so completely and utterly stupid and inconceivable that an oncologist can ignore a cancer stem cell, because you cannot. We don't like to use the word cure, but you cannot induce a remission unless you deal with the stem cell. You have to deal with the stem cell. And we know what the pathways are. Again, this is all biochemistry. It's well published. We know the pathways that are involved with the cancer stem cell. And so guess what drug is the most effective drug for dealing with, and I hate to say it and you laughing, the cancer stem cell.
Where's the horse case?
Here it comes. It's this word that, you get banned.
And you see, you don't have to ask me. You can go to AI, and AI is not going to lie to you.
Sure.
It's the eye drug. The eye drug is the most effective drug in dealing with cancer stem cells. And then you combine that with, the other antiparasitic drug, mebendazole. They're very potent together. And then you add vitamin D. So those 5 drugs form the basic components of our basic therapy. Green
including
tea,
the ECGC and the curcumin.
yeah, the
Yep.
ECTC, the curcumin, the ivermectin, the mebendazole, and vitamin D. Those
Yeah.
5 serve the basic or the cornerstone of all of our treatment protocols. And then there are other things that you can add, but we believe those are at this point in time the 5 major drugs or agents patients need to take. And when we talk about ivermectin, we're not talking about doses, gazillion milligrams. We're talking about, 0.3 initially to 0.6 milligrams per kilogram. And when we talk about bendazole, 200 milligrams. So, these are reasonable doses because there are people out there recommending completely ridiculous doses. The
Right.
other thing that I need to say is that there's this notion out there that is perpetuated by complete goofheads. I think they're goofheads or nutcases, or I don't know what you want to call them, who believe that because ivermectin and mebendazole are active against cancer, and because ivermectin and mebendazole are parasitic drugs, that cancer is a parasitic disease.
Thank you.
So these people are complete and utter nutcases. Because as I've explained to you, ivermectin works via specific pathways.
Right.
This is well reported in the medical literature. This is not made up. And these pathways have nothing to do with the way ivermectin kills parasites. So it's just one of those remarkable things about ivermectin. It's this multi-potent drug that acts via multiple modalities. One of the ways it doesn't kill parasites, but it's not the way it kills cancer cells. And so there is this ridiculous notion that patients should go on a cancer cleanse. A parasite cleanse. So what you need to do to prevent cancer or treat cancer is go on a parasite cleanse. It's complete and utter BS. And we need to stop this nonsense from being further perpetuated. Ivermectin acts via specific biochemical pathways which interfere with the cancer stem cell survival. It's as simple as that.
Yeah.
And then obviously the other things that are important is the immunity. It's really important. I mean, cell surveillance and T-cell immunity is really important. That's how we get rid of cancers, is we have our T killer cells, our lymphocytes are getting rid of cancer. And to have therapy which knocks out your immune system makes absolutely no sense. It just so happens that curcumin and green tea actually have very important effects on your tumor microenvironment to improve your T cells and to suppress your myeloid depressor cells and your T regulatory cells. So these drugs have multiple modes of action. So it's a beautiful orchestra that's played together with all of these drugs working together, working on the stem cell, the specific biochemistry of the cancer cell, working on the tumor microenvironment, the tumor pH, the tumor immunological status. It makes no sense if you think about it. The way we get rid of cancer cells is our immune system. Why would you want to whack out our immune system? And then you have things like angiogenesis, which promotes metastases. So it just so happens that all of these drugs act on all of these pathways to improve the outcome of cancer.